Hello, everyone, and thank you so much for joining us for this first webinar of the series of the Lancet Countdown on addressing current challenges and emerging risks through climate health indicators. As you hopefully all know, this first seminar will be about climate change and infectious diseases indicators. And I'm so delighted to be here with you, to see so much interest and so many of you joining us today for this webinar. We're delighted to have the presence of world-leading experts in this field. And what I'm going to do today is to start us off by giving you a bit of an overview of what it is that we do, what the Lancet Countdown does, why we focus on indicators, and what our aims are for this upcoming series before I pass you on to our experts to talk us a bit more about how indicators are used to tackle climate change and health issues, particularly focusing on infectious diseases and the latest developments in the development of these indicators. My name is Marina Romanello. I am the Executive Director for the Lancet Countdown on Health and Climate Change. The Lancet Countdown is a big international collaboration. We bring researchers from all around the world. We're lucky to have contributions from over 130 organizations globally. Over 300 researchers today contribute to the different aspects of the Lancet Countdown's work. And as you can see on screen, it's getting a bit busy. But we're so delighted to have such representation and increasingly global representation as well, with some of our low middle income colleagues also contributing to this work increasingly. The work of the Lancet Countdown is basically focused on publishing annual iterations of indicator reports. These are scientific publications. We generally publish in the Lancet group of journals, or the Medical Journal of Australia in the case of our Oceania report. And with these reports, we produce iterations of over 60 indicators. The Global Lancet Countdown publishes the global reports that you see on screen here at the top. We're currently working on our 10th annual indicator report, so we have been doing this for a while. But we also have 6 regional centers, as you can see on screen. And these 6 regional centers dive deep into these world regions. We have Small Island Developing Stage, not a region, arguably, but a very important set of countries, particularly vulnerable to climate change. We have a center in Latin America, a center in Europe, a new center in Africa, one center in Asia that focuses largely in China, but is also expanding to other parts of the region, and a center in Oceania. And each of these publish indicator reports looking in depth into these different world regions at the intersection of climate change and health, how the impacts of climate change on health are evolving, what are our emerging and established risks, but very importantly, how our actions to tackle climate change affect health and what are the health opportunities of that transition. Now, we focus largely on indicators. Why do we do indicators? Well, indicators can be incredibly useful. Each indicator on its own right is a data point that we monitor in time, how it changes. They're by definition quite reductive because you have to have one piece of data, one number that changes in time, but they tell quite a rich story when you pull them all together. Each indicator being a proxy, but all together in our report telling a very comprehensive story and allowing us to do quite a detailed assessment of the state of climate change and health. So indicators can be used to monitor evolving situation and identify risks. We have indicators that monitor different aspects of the risks of climate change on health, looking at exposures, looking at hazards, looking at vulnerability, looking at risks, and eventually looking at impacts. They can also be used to inform policy priorities and resource allocation. Once we see what these risks are, what the impacts are, they can be used to inform our priorities to protect health from climate change. They can also be indicators that help us monitor progress in terms of policymaking, used for monitoring, evaluation, and learning frameworks, looking at what countries are doing, what different organizations or subnational bodies are doing in terms of responding to climate change. And in that, they can also help inform priorities and resource allocation. They can be really useful to benchmark and to set targets, see where we want to head to, and then provide a monitoring system to see the extent to which we have achieved or not our targets. They can be used to evaluate interventions. They're really helpful to ensure that we're speaking with a common narrative when we do that evaluation of the impact of interventions on health, on climate change, and their intersection. And obviously, in all of that, they're really important to ensure accountability. There's also a whole set of indicators that tell very compelling stories and can expose inequities, can expose the urgency of action, and can help mobilize political will and galvanize efforts and cooperation, particularly when they point to the solutions and the potential benefits of climate action. And in that, they also obviously are very useful to raise awareness and support communication efforts, ensuring that we're all speaking with one voice and we have a clear narrative built off the back of them. So this is why we focus on indicators. We find them such useful tools, and they can help mobilize action and direct action in ways that are very evidence-informed and that can ensure all of that engagement that underpins action on health and climate change. And we're not the only ones that love indicators. There's many, many processes, increasingly a large number of processes that are also working on developing indicators. We, together with the WHO, co-lead the ATTACH task team on health and climate indicators. This is the Alliance for Transformative Action on Climate and Health, a community of practice which seeks to advance action on health and climate change that is evidence-informed, and we're in charge in supporting the alignment of different indicators globally. You might know that under the Paris Agreement, there's a commitment to deliver a global goal on adaptation, and there has also been a huge effort in terms of developing indicators to monitor progress towards global adaptation to climate change, including for health. The WHO is obviously very committed on evidence-based action and therefore is now working on developing indicators to monitor progress against the Global Action Plan, which comes off the back of the General Program of Work 14 that has acting and addressing climate change as the first strategic priority of the WHO over the next 3 years. And last year, the COP30 presidency launched the Belém Health Action Plan, also getting countries together to deliver climate-resilient, low-carbon health systems, and also is undertaking a process of developing indicators against that action plan. We come in the midst of those efforts, but we're not the only research project looking at indicators. The Lancet Sustainable Healthcare Commission is also working now on developing indicators on sustainable healthcare, and that commission hopefully will be published in upcoming months/upcoming year. The work that the European Commission has been funding as well through projects such as IDAlert, Catalyze, and many, many others are also underpinning very relevant and indicators at the European level, which we and others are learning from as well. And there's an international effort led by the Office of National Statistics of the UK that has been funded by Wellcome, but is engaging with the UN Statistical Office to develop standardized methodologies for the development of indicators on the health impacts of climate change too. Finally, countries at the national level are also developing tons of indicators, no least for the vulnerability and adaptation assessments, the national adaptation plans, and many other processes. And I'm only scratching the surface of the enormous amount of processes that are working now to develop indicators on climate change and health. But as you can imagine, this brings a bit of noise. We're all trying to advance the development of indicators. They're such powerful tools. And what is really crucial is that we're, in doing so, leaning on the best available science and ensuring as far as possible alignment across all of these different processes. And that is one of the things that we as Lancet Countdown are very interested in enabling, that we can encourage a conversation about indicators that allows us to align in concepts, align in the direction of travel, and importantly, deliver indicators that can really support action at a national level. So this is one of the cartoons that IDAlert has produced. There's a very lovely book of cartoons on infectious diseases that I do encourage you to look at online. We're using indicators to tackle infectious diseases. And they are really, really useful tools. So today we're going to hear a bit more about this from two world experts. Firstly, we're going to hear from Professor Jan Semenza. Professor Jan Semenza has an enormously long trajectory in working on infectious diseases and on climate change. He's also the lead for the working groups 1 and 2 on the impacts and risks of climate change and adaptation to climate change at the Lancet Countdown Europe Centre, and he's a co-lead of the IDAlert early warning platform. After that, we're going to hear from Professor Rachel Lowe, also a world-leading researcher in developing models for infectious diseases. She's an IDAlert co-coordinator. She's a lead also of the IDAlert early warning system work stream, and an author of the Lancet Countdown on Health and Climate Change from the very beginning, as is Jan Semenza. Unfortunately, due to unforeseeable circumstances, Dr. Willie Lescano will not be able to join us today, but we're still going to have a very rich discussion about infectious diseases led by our two experts here today. Just to say, you will have the opportunity to ask questions after the presentations from Jan and Rachel. So please do share your questions in the chat. We have a Q&A function that you can see, I think, in the bottom of your screen. So please do share your questions there, and we'll do our best to address it. If there's any questions that we haven't, we're very happy to follow up via email. And just bear in mind that this session is being recorded, and by participating, you're consenting to being recorded. So bear that in mind as you interact with us. And yes, look at the Q&A space. We'll do our best to address your questions. Coming up next, we will share this recording via the Lancet Countdown and the IDAlert websites for those of you who couldn't join us live but are still interested in joining and following this conversation. And as I said, this is the first webinar in a series on climate and health, where the Lancet Countdown is seeking to share our knowledge, our expertise over the past 10 years of developing climate change and health indicators, and also in learning from you guys. We know that there's so much work happening all around the world, so hopefully this also sparks some ideas of how we can collaborate with many of you. And we are, as always, an open collaboration, so we very much welcome further insights. This July, we're going to have the second webinar that will be focused on heat and health, so please stay tuned for more information on that. Finally, I wanted to share that we're going to share a post-webinar survey. This is the first webinar that we've done, and we're really, really interested in learning from this experience, hearing from you on what works, what doesn't. So please, if you could take a moment to respond to the survey after this webinar, we would be so grateful to learn how to improve the way that we engage and share our expertise. Follow us online for more information. And in the 5th of May, we're also going to have an information session focused on our policy collaboration. So if you're interested in engaging with policymakers and being part of our policy workstream, please do join us also on the 5th of May, and more information can be found on our social media and across our webpage. So without further ado, I'm going to now hand over to Professor Jan Semenza to walk us through the indicators on infectious diseases and how they've been used to guide policymaking. Jan, the floor is all yours.
Thanks, Marina. Let me see if I can share. Can you see that?
We can see it, although not in full screen, at least not yet. Now it's in full screen. Thank you, Jan.
Perfect. Great. Thanks, Marina. Hey, thanks for that nice introduction. And thanks, everybody, for showing up today for this session on indicators for climate change and health, with a focus on infectious diseases. But most importantly, I would like to thank Claire, Camille, and Chloe from IDAlert to have made this webinar possible, and obviously also our funding sources, the European Union and Welcome, that are behind the financing of these type of activities. On the very top here, you can see these two logos. I'll be presenting two reports today, work that has been done as part of the Lancet Countdown Global that Marina was heading, and that now is probably like a few months old. It probably came out in December last year, so it's really fresh also. And then the European one that just was published last week, and I will be making references to those two reports, and I would definitely like to encourage you to look into those and look at those, because they will definitely inform your next vacation plans. Okay, guys, time to choose: heat wave, heavy rains or West Nile virus. And that's what we're up against, right? So there are so many challenges out there. And what the Lancet Countdown has done is trying to complement what's being done with IPCC, where we're trying to assess the state of knowledge, what do we know? But the Lancet Countdown is developing these indicators that Marina described so nicely to get a handle on what is happening, where are we going, and what do we have regular updates that can quantify these trends that are happening. They should be policy relevant, obviously, so we can influence policy, but that's the key of this approach and this strategy, to come up with a coherent monitoring strategy by developing these type of indicators. And let me show you the first one. This is something that was developed in Rachel's group now a year ago or so, where we have been trying to look at the climatic suitability for tick-borne diseases. As you know, ticks are the second most important arthropod vectors for infectious diseases after mosquitoes. And here, this one here looks at a threshold-based model taking temperature into account, but also humidity, daylight, land cover, and so on, to get a handle on the tick suitability for a number of ticks worldwide. And you can see that based to the baseline here, and in this case, the years from 1950s for like a decade or so, compared to a more recent time period, we see like an almost 7% increase or 3% respectively, depending on the ticks of the climatic suitability that has improved for these tick-borne diseases. And so we wanted to look at this in more detail, and so we drilled down into the science to see on a regional or in a local level, what does that mean? And in this case, we looked at Sweden, where I'm based. And here in Sweden, in Northern Europe, we have a disease that's called tick-borne encephalitis, which doesn't exist in the US, but it's a big issue in Europe and Asia. And you can see that if you look at these 5,000 cases or so over these years, there has been a dramatic increase in these number of cases of tick-borne encephalitis in Sweden, particularly around Stockholm, where I live. And that is obviously quite a concern. And we would like to see what drives this potential increase. So we set up a machine learning algorithm to compute what are the underlying drivers for disease transmission for Sweden, at least. And so we had very high resolution data in this case, because the Swedes record exactly where that exposure happened, if that, in some cases that is possible. And we use this high resolution data to assess the drivers of this increase. And we did in fact see that the mean temperature was the strongest factor of tick-borne disease in Sweden, which reflects what Rachel has shown on a global scale. Obviously, a lot of other variables are factored in here as well. For example, roe deer density, which is like road kill, where you can see an interaction between humans and animals, and that's where the risk is the highest. But interestingly, we do not see all the same variables to show up like the one that Rachel used based on the lab and field data that she based her model on. It turns out that relative humidity was not an important factor because it was reversely associated, because in northern Sweden, it tends to be cooler, wetter, it's forested and no people. And so we see a very particular feature of this model here that applies to Sweden, but probably not to other parts of the world. So you can see that advantages and disadvantages of these indicators. While we have been speaking about mosquitoes, it turns out that the mosquitoes are having a field day. So ticks are one thing, but the mosquitoes are another one. So let's move on to mosquito. And here is an indicator that was developed by Joachim Rochlöw in Heidelberg. And you can see the increase in the climatic suitability for Aedes mosquitoes. And Aedes mosquitoes are the ones that transmit dengue, chikungunya, or Zika, which are a big public health concern, particularly in tropical diseases. And you can see that the climatic suitability, or this estimated R naught. So this is not actual true R naught. So we don't compute are not based on cases. We compute the climatic suitability in this case. And you can see specifically for the Asian tiger mosquito or Aedes albopictus, that suitability has increased almost 50%. And when you look at Aedes aegypti, even almost 12% as well. So there has been an increase. And so then when you see this kind of increase, you're concerned about the potential public health implications. Obviously, the first thing you think of is the big epidemic that we had in Brazil and South America in 2024. You can see here the Americas, the dengue cases for Americas with almost 13 million cases. That was due to the transmission of these mosquitoes. But obviously, this cannot just be climate, right? Climate doesn't change that fast. So there need to be other factors that need to be taken into account. And so we basically know that population mobility is another factor. A lot of people, for example, come from tropical areas into Europe, and that contributes to dengue transmission in Europe, because if an individual gets bitten in Thailand, for example, by a mosquito, and then they get infected with the dengue virus, and then they travel home, and within that viremic period, when they have the virus in the blood, they arrive in back home in Sweden. A lot of Swedes go to Thailand, in fact, and they go to southern part of Europe, where in fact that Asian mosquito is present. And so now that individual gets bitten by a local mosquito and that can be transmitted to someone else. And then we have these local outbreaks. And that's exactly what we looked at. We looked at these local outbreaks of dengue and chikungunya in Europe. And you can see that there's this exponential increase over the last few years with these type of local outbreaks. So these are not imported cases. These are local outbreaks. And it turns out that the Asian tiger mosquito was introduced into Europe, into Italy specifically in the 90s, and has been spreading ever since. And we can see that more and more of these districts in Europe are now affected by these type of outbreaks, specifically in Croatia, France, Italy, and Spain. So we can see more and more of these districts being affected. So we wanted to know what contributes to this increase in cases. And so when we asked the question, if you look at the district, when that mosquito arrived in the district, how long did it take to have the first arbovirus outbreak? And you can see that in the 90s on the y-axis here on the left, you can see that it took 25 years for the arrival of the mosquito until we have the first outbreak in that district. But then if you look at more recent years, that has now decreased to 5 years. It has accelerated. So the mosquito arrives in a new district, and within 5 years, you have the first outbreak of dengue or chikungunya. So we set up a multivariate analysis to compute the hazard ratio of what type of factors contribute to these type of outbreaks. And we see that urban environments are particularly at risk, but obviously imported cases is a driving factor, and so is health expenditure, but obviously summer temperatures as well. In fact, that is the strongest factor. So that's the biggest driver of these outbreaks in Europe, because mosquitoes are cold-blooded. So let me know when it's 18 degrees or higher. They don't like it when it's cold. And so when we now stratify the colder districts against the warmer districts, you can see that there is a stark difference between the survival curves in the cold district compared to the warmer districts. Warmer districts are more likely to experience these type of outbreaks once the mosquito has arrived in that district compared to the older districts. And you can see how these two curves between the colder district with 20 degrees summer temperature compared to the warmer districts. And so that's how they break apart. And so temperature now seems to be a driving factor here. Mean summer temperature is an important factor in these local outbreaks of the dengue and chikungunya in Europe. And then coming to a different type of a transmission pathway, waterborne diseases, This one here are Vibrio vulnificus infections. And in fact, it turns out that when we see global temperature increase, it turns out that there are lots of marine heat waves besides the ambient heat waves that we experience. So the oceans absorb something like 90% of the heat, and that leads to an increase in the sea surface temperature. And that is a particular issue where we have water with low salt, like brackish water in an estuary, for example, where now these bacteria, they propagate under these perfect environmental conditions. So low salt content and high sea surface temperature, that leads to propagation of these type of bacteria, and that's when that exposure can happen. It turns out that these exposures are very dangerous, particularly if you have a wound, if you're compromised, and they can lead to gastroenteritis, but also septicemia, wound infections, and they have a high case fatality rate. In fact, in the US, it's the most expensive marine infection that's out there because of amputations that might be required from this type of an infection. So when I worked at ECDC, we set up an early warning systems for these bacteria where we monitor sea surface temperature and salinity. And this now is a slide from the European Lancet Countdown, where we look at sea surface temperature in Europe, and you can see that these blue-green curves, that applies particularly for the Baltic areas, where we can see a dramatic increase in that climatic suitability for these non-Vibrio and non-cholera Vibrio infections. We can see like a 30% increase compared to baseline. That puts a big population at risk from these potential Vibrio infections. So this is a potential application that where these indicators now can lead to early warning systems for public health purposes. So in summary, these indicators, they have a lot of strengths. So they provide early warning signals of emerging risk. Dengue transmission potential is one of them that I mentioned earlier, but they also allow cross-country comparisons to see what the situations and the risk profile is between different regions and countries. They also provide a baseline to allow trend analysis. As I mentioned earlier, we are interested in where are we going, what is happening, are we on a good trajectory or not? And that's why these indicators are so important. And they are, in fact, scientifically based on biological plausibility. An example is a tick indicator where we use temperature and humidity as thresholds, but then we have looked at a number of transmission pathways, mosquito, tick, and waterborne transmission, and ideally we would like to look at foodborne transmission as well, but we haven't developed those indicators quite yet. However, there are also weaknesses. Some of the issues that we're struggling with is the fact that these indicators, they look at climatic suitability as opposed to actual disease cases. It's very difficult to get your hands on global incidence data for infectious diseases. It's very difficult to account for control measures and to get a proper handle on what's going on disease, on the disease level. So that makes it difficult. We have only limited data on socioeconomic factors. The European team is planning to publish an urban report that's coming out pretty soon, where we're trying to address some urban issues. But in general, we have poor information on migration, poverty, and sex, other demographic variables that are essential for these type of analyses. We have a number of biological thresholds that you need to account for different ticks, different environments, and so on, or different other transmission pathways. And so it's difficult to come up with a global consensus on that. We often struggle with that resolution issue where we have spatial resolution limitations. As I mentioned earlier, with the tick high resolution analysis we're able to do in Sweden, but maybe not in other places. And then obviously this is a limited set of climate sensitive infectious diseases. We would like to include more zoonotic infections. We used to have a cholera indicator, but there are some limitations to that one as well. And then maybe the biggest limitation is this attribution challenge. how do we tease out the climate signal from other drivers? I mentioned mobility, population mobility, land uses, and other drivers that we need to account for. How do you account for anthropogenic climate change specifically? Because that's what we are interested in, and it's very difficult to tease out these different factors. So in summary, we've got hold of a vector-borne disease preparedness plan, says the mosquito, and then the tick asks, so what is their strategy? That's a bit hard to tell right now, because in fact, we don't really have a good preparedness plan. And that's why we need these type of indicators, so we know where we're going and we know what's coming up on the horizon. Most importantly, I would like to acknowledge the work by all the collaborators, Zia Farouk in particular, Joachim Lowe, and others. And I mentioned Marina's report and Heidi Kritz's report, and then, of course, our funding sources, the European Union. And I think I'll leave it at that with my email. Any questions, just shoot me an email and we can communicate online. So I roll it over to Rachel. So Rachel is based in Barcelona, the Barcelona Supercomputer Center, and she is a research professor at the Catalan Institution for Research and Advanced Studies. And I stop sharing here and I roll it over to my good friend, Rachel. There you go.
Thank you so much, Jan. I will just share my screen. Can you see that okay?
Yes, it's showing. Thanks, Rachel.
Thank you. So it's a pleasure to be here, and it's a real honor to present after Jan. Thank you very much. So I will, following on from Marina and Jan, I will share some details about the kind of decision support tools that we're working to develop to try and strengthen resilience to emerging infectious disease threats. But often one of the questions we're faced with is, how do we define what a climate-sensitive infectious disease is? How do we measure the level of climate sensitivity of different infectious diseases? And recently, Tilly Alkainer and our colleagues at MSF and the Red Cross, we published a viewpoint trying to dig into this problem and trying to think about the different ways that climate variability and climate change influence the emergence and spread of different infectious diseases. So there are several ways in which climate can impact disease through changes in the average climate conditions, as we've seen with global warming due to greenhouse gas emissions. And that's contributing to changing both the seasonality and the geographical distribution of diseases, which is leading to shifts in seasonality. So we may see longer transmission seasons. We may start to see double peaks where the middle of the season becomes too hot for certain vectors and the pathogens they transmit. And we're seeing expansion or shifts in the geographical ranges of different diseases, with certain diseases spreading to higher altitudes or latitudes. We're seeing more examples of highland malaria, for example. As Jan explained, we're seeing more and more locally transmitted outbreaks of dengue and other Aedes-borne diseases in Europe. But as well as these sort of long-term trends, we're also seeing changes in intraannual variability. We're seeing more extreme and severe weather events, which can change the timing, intensity, and duration of outbreaks. So at the Global Health Resilience Group at the Barcelona Supercomputing Center, we're working to try and integrate different types of climate information into decision support systems across multiple different timescales. So our work within the Lancet Countdown, both the global and the Europe report, we're looking to make use of historical climate observations, often obtained from reanalysis products, which are known as these maps without gaps, which give us gridded products, fine temporal and spatial scales that we can then use to generate these global indicators. And as Jan explained, these are very much tracking changes in climatic sensitivity rather than the disease risks themselves. And then we can use these indicators as well as more sophisticated epidemiological modeling approaches to incorporate different types of weather and climate forecasts so that we can make short-term predictions into the future. So we can try and understand the changing risk of outbreaks both in space and time. And we can also make projections further into the future using different projection products from, for example, the CMIP6 project, where we can look at different levels of greenhouse gas emissions, which depend on the decisions that governments make in terms of the mitigation actions they will take to limit different levels of emissions. And then we can conduct scenario analyses to see the changing health burdens depending on the decisions that governments make now to mitigate and adapt to the changing climate. And these kind of decision support tools can allow us to inform preparedness and response plans in terms of mosquito control. They can guide adaptation measures, including reforesting and other nature-based solutions. They can also allow us to evaluate different kind of interventions, for example, the rollout of Wolbachia, and how climate-driven models can help us understand the changing risk without those interventions, but also how climate change can impact those interventions themselves. And we're also moving into the space of health impact attribution, where we can develop models to help inform and guide different loss and damage financing, for example. So here's a collection of studies that we've developed, trying to develop open source methodological frameworks to allow researchers and practitioners to be able to understand the delayed and nonlinear impacts of different kinds of hydrometeorological and climatic drivers on disease risk. There are examples here of developing modeling approaches using extreme climatic events in the Caribbean. We've also, through our collaborations in IDAlert and the Lancet Countdown, developed different kinds of indicator models and frameworks for leishmaniasis, for West Nile virus, and for Lyme disease. We've also discussed ways in which Europe can learn from the decades of experience of implementing vector-borne disease control measures in endemic settings, and what we can do to strengthen our resilience in Europe from those international collaborations, and develop different kinds of early warning systems, from leptospirosis early warning systems in Argentina to dengue and malaria early warning systems in Colombia or South Sudan. So we've been developing the kind of indicators that Jan's described. I'm just pulling out two examples here that were depicted by Nature News. We can see on the left how newly suitable areas for the transmission of both Plasmodium falciparum and vivax over recent decades compared to a 1950s baseline. And also an indicator that we developed specifically for the Lancet Countdown in Europe a couple of years ago now. We can see here how climatic suitability based on a machine learning model is gradually inching northwards. And this has implications for the control of leishmaniasis in these countries where it was not previously endemic. And as well as the modelling approaches, we've been also working on how we can best disseminate and communicate this information to different audiences. And my last job before I stepped down as director of the Lancet Countdown was to work on translating the findings from our 2024 Lancet Countdown in Europe report into a way to try and communicate this research for a younger audience. So we published an article together with these lovely visualizations that were produced by Dr. Kim van Dalen. And we published this in the Frontiers Young Minds Journal. So do check that out. And we have all the resources and infographics available on our IDAlert website. So a couple of years ago, a few of us were commissioned by the Wellcome Trust to publish a landscaping review of software tools available for climate-sensitive infectious disease modeling. And out of tens of thousands of articles, only 19 products were identified as having potential to provide operational information for managing climate-sensitive infectious disease risks. And we see a huge gap between modeling efforts that remain in the academic literature and actual products that are used and reach decision makers to actually change the way that we respond and adapt to climate change. So we've been through several projects we have funded by Horizon Europe and the Wellcome Trust, been working towards co-creating different types of decision support tools to fill this gap. One of the products we've been developing is called IDAlert, and this is a seasonal indicator platform developed within IDAlert. And we've also been developing a suite of R packages that we're calling the Global Health Resilience Toolkit, or GHR tools. And this includes packages from both the Harmonize and the ID Extremes project to allow users to harmonize and bring together both health and climate data at the same space-time resolution, so it then can be used to develop robust early warning system models. And we have packages that allow users to explore the data, to model the data, taking into account all these different delayed and non-linear impacts of climate, and then to make predictions into the future using either seasonal climate forecasts or longer term projections. And we're now developing this so we can also work with counterfactual climate, so we can work towards really digging into this health impact attribution. And the GHR toolkit was recognized as an emerging global good in this guidebook that was published by the PATH initiative, funded by and supported by the WMO-WHO Joint Office and Wellcome Trust. So just to share a few more details about our EPI-Outlook platform. So together with our collaboration with the Lancet Countdown in Europe, we've been adapting these indicators that were initially developed to track annual changes in climatic suitability for infectious diseases. And we're looking to see how we can adapt these indicators to help us track and estimate the evolving changing climatic suitability throughout the season in Europe. So we currently have indicators available for the Aedes-borne diseases, including dengue, chikungunya, and Zika virus, also for West Nile virus, malaria, and tick-borne diseases, as well as an additional drought indicator that allows us to monitor both severe drought and exceptionally wet conditions. So on our EPI-Outlook platform, which will be launching on the 15th of June, so watch this space, we have developed this platform together with our different partners and users across Europe, including the European Environment Agency and the European Centres for Disease Control and Prevention. And in this platform, users can visualize across the different NUTS3 regions of Europe the probability of a suitable month in this region from 1 to 6 months in advance. And we have options to select a specific region and then be able to visualize how that indicator was produced in terms of the climatic drivers that were used to produce it and the uncertainty around the seasonal climate forecasts that feed into that prediction. So the main functionalities of the EPI-Outlook platform is that we can visualize seasonal forecasts of climatic suitability. We can also analyze anomaly maps. We have a set of socio-demographic layers, so we can understand for example, in urban areas how the climate suitability is changing. We also have vector presence layers, and we're incorporating both locally transmitted and imported disease cases. And we have the option to be able to download both the images and the data from this platform so that users can incorporate this information into their own decision support tools. So just a little bit more about how this works as a climate service for health. We're bringing in these climate forecasts to make estimates of changing disease risks from 1 to 6 months in advance in each of the NUTS3 regions. And this involves a process of forecasting the monthly variables and downscaling that climate information using both hindcast and reanalysis products, spatially aggregating this gridded data to the NUTS level, then calculating the indicators using the kind of indicator modeling approaches we use in the Lancet Countdown, which we're now also expanding with different kinds of modeling approaches, including mechanistic and machine learning models. And then this produces the probability of suitability and its evolution across the season. And here's just a closer look at how we can visualize those inputs, for example, looking at the evolution of monthly temperature and relative humidity across the season. And then we can compare the 12-month outlook, which stitches together the forecast climatic suitability for the first 6 months. And then we bring together the climatology so we can try and estimate how long a transmission season may last based on a combination of forecasts and our experience over the previous decade. So we'd be delighted if you would join us for the IDAlert launch, where we're going to share our co-production journey. So we will have a panel of experts and users from across Europe, which will be chaired by Jan Semenza on the call. And you'll also hear from the interdisciplinary team of developers of this platform, their experience of the knowledge engagement, the knowledge integration, the design of the platform, both the front end and the back end, how the seasonal climate forecasts are produced and how they're integrated with the indicator models we've been developing. So these kind of tools are very relevant for emerging settings, and we've also been developing tools that can allow us to develop more advanced epidemiological models where we have a long history of disease cases. So using these toolkits, and we have target users including public health institutions, humanitarian organizations, and disaster risk and environmental agencies, and different researchers. And this has allowed us to integrate different modeling approaches that can allow us to account for these compound and cascading disease risks. So, for example, if we're experiencing a drought, and then we have a forecast for exceptionally hot and wet conditions, then we can develop modeling approaches that can allow ministries of health to get prepared for a high risk of dengue in the coming months. Whereas if we're experiencing a drought and the forecasts are for cool and continued dry conditions, then there can be advanced knowledge that there's less likelihood of a dengue outbreak. We recently put this kind of approach into practice. A study led by Chloe Fletcher provided a dengue early warning ahead of the 2024 Cricket World Cup that took place in the Caribbean. And this early warning system was co-created and shared with the Ministry of Health months in advance of the event, which allowed increased control and surveillance activities around the stadiums, which averted a potential outbreak at that time. We've also been using this framework to take part in the InfoDengue forecasting challenge. So this is a challenge that's been put together and commissioned by the Ministry of Health in Brazil, and a team called Moss Climate who are part of the InfoDengue team in Brazil, have been bringing together different research teams and modeling groups across the globe to produce these very long-term forecasts. So we're looking at an entire year ahead. And both in the 2024 and the 2025 sprint, the GHR modelling framework seemed to do a good job, particularly in certain regions of Brazil, and was in the top 2 of the modelling teams in the last sprint. So this gives us some hope that the tools that we're developing can make a difference for policy and practice. And we're also developing front-end tools to be able to display this information for our partners in Southeast Asia. And just to finish up, as well as developing these modelling approaches, we're also looking at the implementation side and the challenges and the barriers around that. A paper published by Avril Diaz in PLOS Climate lays out the different kinds of questions that need to be posed to really move towards implementation, including thinking about the different kind of partners who need to be involved in what capacity, the kind of graphical outputs that are needed, who will be responsible for creating, conducting, monitoring and evaluation of early warning systems once they're implemented, and how is this beneficial for the general public. An important part of that is capacity strengthening, knowledge exchange, and community engagement. Just if you would like to learn more about the work we've been doing in Harmonise, you have here a documentary that was produced and is available on the Welcome YouTube channel. We have a version of this film in English, Spanish and Portuguese. And I'll leave it at that, thanking our funders and the Global Health Resilience Group and all our partners in IDAlert and Lancet Countdown. Thank you so much.
Thank you so much, Rachel, and thank you, Jan, also for those two fantastic presentations. We've received a few questions on the Q&A. Please do submit your questions if you haven't yet and you're interested in asking any of them. We have quite a few questions on IDAlert. Unsurprisingly, Rachel, loads of interest in it. People want to know whether they can access and use it yet. I think you said that is not launched, but you have a public event, so maybe we can share more details on that to all attendees later on. They're asking also whether it covers the UK and Ireland and whether the code will be publicly available.
Sure. So in terms of EPI Outlook, I can bring up the slide again. So we're scheduling an online launch of the event on the 15th of June. So we will be publicizing that very soon. We're just finalizing last few details. And for anyone who actually is in Barcelona or will be in Barcelona, we're holding a local launch on the 3rd of June as well. So after that moment, the platform will be available online. We want to have an initial phase where it's available for all to be able to use and explore, and we will be continuing to improve it through user experience and feedback. So we'd be very happy for you to start interacting with the platform. All the code behind the indicator models themselves are available on the GHR GitLab. So we publish all the code that is used to produce the indicators that are included in both the global and the European Lancet Countdown reports. And we will be sharing the codes for the EPI Outlook as we go as well.
Excellent. Thank you so much, Rachel. We also have a couple of questions regarding one in particular regarding about how the indicators for this type of analysis accounts for social interactions with the diseases. So, for example, one of the persons asking this question is saying there's big differences in how societies perceive and live with vector-borne diseases. In some cases, you have these outbreaks of dengue or chikungunya as recurrent managed outbreaks. So they're asking how do the indicator frameworks address this and whether they risk overframing these dynamics purely as outbreaks rather than socio-ecological interactions. And maybe you can tell us a bit more about kind of the difference between baseline outbreaks and what climate change is doing and how the indicators capture that. Do any of you want to take that one on?
Sure. I mean, basically, these indicators, they look at the relationship between these climatic and eco-climatic drivers and see how they relate to cases. And they don't necessarily only focus on outbreaks, but obviously outbreaks are part of that also. And in certain circumstances, they become endemic as opposed to epidemic. And in fact, what we have looked at in Europe in particular is that we're going from these outbreak scenarios into more endemic situations, and what does that mean for public health in general, right? I mean, what do we need to do when it comes to preparedness for these type of diseases if they're in fact on a trajectory to become endemic in the southern part of Europe? And so the indicators are trying to capture some of that in order to, prepare us for the future by putting the proper preparedness measures in place and trying to consider other strategies to trying to contain these type of outbreaks. So they are trying to get a handle on what's going on at a social, ecological, and climatic level.
Excellent, Jan. Thank you so much. And a related question that has a bit to do with attribution and the extent to which we're capturing what is an anthropogenic interference, an anthropogenic influence versus what is a baseline ecosystem dynamics. You talked a bit about attribution, and I know that is kind of the holy grail when it comes to climate change and health. Can you tell us a bit more about how we're working or the progress in terms of attributing these outbreak dynamics to climatic suitability or climate change driven changes?
I mean, that's a great question, right? That's what it's all about. How do we actually attribute changes to climate and climate change in particular, anthropogenic climate change? And we are trying to work on something along those lines for on the European scale as part of the Lancet Countdown Europe, where we're trying to develop a projection report where we're looking at pre-industrial counterfactual climate and overlay that relationship over the current infectious disease incidents to see how those curves diverge under current and the counterfactual scenario. And so then that difference then can be attributed to anthropogenic climate change. But it is difficult, and I don't think anyone has the ideal strategy how to go about that, but that's what we're trying to do, to come up with these pre-industrial climate that we overlay over these models to come up with a scenario to see how would it have looked like without anthropogenic climate change.
Excellent. I think very related to that, there's an interesting question here about whether an early warning system could introduce bias into the model because the warning itself triggers interventions or behavioral changes. Can you talk us a bit more about how this information builds into early warning systems and what are the measures put in place or the controls to ensure that the response is commensurate to the actual threat and to account also for the response?
Yeah, I mean, that's what we go ahead, Rachel.
Oh, sorry. Yeah, no, that's a challenge we face. We spent a lot of time trying to develop these early warning modeling frameworks and to at least in the initial phases evaluate them statistically to ensure that they're producing robust information before they're rolled out. But once they are rolled out, you move into this scenario where you can't really statistically evaluate false alarms, or you don't know if you're working with a false alarm or a successful intervention. So then you start having to move into a different kind of evaluation framework and start trying to see what other metrics you will use to evaluate its success. So rather than these statistical metrics, you may be looking at other ways that the early warning system has triggered a certain response or has changed an action or led to a different way of intervening. So it becomes sort of a very different space. And there aren't a huge amount of examples yet of successful monitoring and evaluation of these early warning systems. There are several examples of how to evaluate them in a kind of theoretical and prototype scenario. But it certainly is very important to be sort of bringing in these additional information, particularly around interventions, and then using these climate-informed indicators or models can help you evaluate how effective those interventions may have been in the absence of the interventions.
And I think a good example is the heat health action plans that have been implemented throughout Europe and throughout a lot of other parts of the world. And they seem to be working really, really well, right? Because you have a heat wave with a certain death rate, and then you implement your intervention. These heat health action plans are supposed to reduce the risk for heat, and you see this huge impact. But in fact, it turns out that you're comparing apples and oranges because the initial outbreak was completely different in that a lot of susceptible individuals were affected by the heat wave, and then these people have died off in the second heat wave. And so you're comparing apples and oranges. And so how do you evaluate these systems? And this is the same thing holds true for infectious disease early warning system. In fact, the only early warning system that's operational on a European scale is this Vibrio one that we built at ECDC, but it has never really been properly evaluated because that's very difficult to do.
Yeah, absolutely. It's such a big challenge, isn't it? We've had some fantastic questions. I will wrap us up with one final one. If we can keep the answers short, because we have 1 minute to go. But this has been such an engaging webinar. Thank you so much for everyone. I know there's a lot of unanswered questions, but please do follow up via email and we can put you in touch with the right person. The last question that I'm going to put forward, and I'm going to tweak it a tiny bit. We have a question about whether this platform that you described, Rachel, can be used through any one health type of disease. I suppose the big question is, can it be translated and deployed in other cases for infectious disease or climate-sensitive infectious diseases? And also, can it be adapted to a One Health approach, including concepts and tracking of animal health as well?
Yeah, that's something now we've sort of have this very nice co-created shell, if you like. This is now ready to be adapted for all different types of zoonotic diseases, also within the One Health framework. Through our collaboration in the E4 Warning Project, we're hoping to be able to integrate bird movement data as a starting point. We're also collaborating and advised by Lowe, so we're hoping to be able to bring in, any databases that can help us understand and track the animal health dimension of this as well. Then it certainly, from a technological level, is able to take that on.
Excellent. And I suppose that once this is out and live, hopefully will be translated to other world regions, right?
Yes, I hope that it can be adapted and extended in terms of emerging diseases. IDAlert is a nice platform because it works with these indicators, which are useful when you're lacking data, like long time series of data. We're working with partners in Bangladesh in IDAlert, where we'd like to be able to develop it further there. And we also have another endemic disease forecasting system called Ncast, which ingests seasonal climate forecasts to make these probabilistic disease risk predictions, which are actually informed using surveillance cases. There's a starting point in South America, but we're also hoping to expand that in Africa and Asia as well.
Phenomenal. Well, thank you so much, both of you. It's always a luxury to hear from you and from your expertise. Thank you, everyone, for having joined us today. As we said, this is the first of a series that we're doing. We're going to share more details about the upcoming one in July, focused on heat and health. And as I mentioned before, on the 5th of May, we're holding a webinar about how we work with partners to translate some of the evidence and the scientific data into policy engagement. So if you're interested in that, please do join us on the 5th of May. I know that there's a lot more questions in the chat that we haven't been able to address, but please do send them via email. You have info@lancetcountdown.org where you can get in touch with us. If not, just look in our webpage. And with that, I thank you all so much. Apologies on behalf of Willie again that could not attend due to unforeseeable circumstances, but it was such a luxury to hear from you, Rachel and Jan. And thank you all for joining us. Have a good rest of your days.
Thanks so much.
Thank you, Marina. Thanks, everybody.